Hi everyone, I am Dr. Johari Hamoy of the University of the Philippines, Manila. I'm going to talk about our project monitoring the chronic viral hepatitis treatment cascade through electronic medical records in the Philippines. Chronic viral hepatitis is a major public health problem in the Philippines. The most recent study estimates that in 2016, 10,600,000 Filipinos have chronic hepatitis B and chronic hepatitis C, respectively. As the Department of Health moved towards a national action plan on viral hepatitis, one of the key elements is the monitoring and evaluation of the program to assess if the targets set are being met. This would require that the terminology service be in place that should be incorporated into the EMRs. Unfortunately, there are no standard terminology sets for monitoring patients with chronic viral hepatitis, even as their signs and symptoms are recorded in the EMRs. The general objective of this study is to have a WH hepatitis program standardized data from participating EMRs all over the country. Specific objectives include to obtain expert consensus on the terminologies related to hepatitis, to populate a terminology service with a consensus terminology, to map EMR terms to the terminology service, and to facilitate the collection of data from different EMR providers into a monitoring dashboard. This is how a hepatitis terminology service will work. In this diagram, you will see boxes on the left are the three health facilities using different EMRs. They are using different terms for chronic hepatitis B. With no interventions, the machine will read these three different terms as three separate disease entities. Hepatitis B will be counted as one, viral hepatitis as another one, and Hepa B as something else. But with a terminology service, where the reference terminologies will be stored, these three different terms will be read as one disease entity, which is chronic hepatitis B. The Department of Health will be in charge of ensuring that this terminology service will be in place and followed. With this, the decision makers will have a more accurate information regarding chronic hepatitis B. This is what we have done so far. We included consultations and establishment of formal agreements between the University of the Philippines, the Department of Health, and the Pathology Society of the Philippines. WHO and EMR providers were likewise identified for inclusion in the project. Experts in the field of hepatitis and health information technology were gathered for a workshop to obtain expert consensus on hepatitis, terminologies, and case definitions. A terminology service was populated based on the consensus of the pool of experts. Already in the timeline will be the engagement of EMR providers and incorporation of interoperability mechanisms where the EMRs will be mapped to the terminology service. Then once these identified EMRs are able to connect with the Department of Health, data will be gathered through these different EMRs where a report will then be generated. For our project milestones, consultations were made with different stakeholders. Formal agreements were then made to ensure institutional support, implementation, and sustainability. A workshop to generate expert consensus on the terms related to hepatitis was conducted and attended by experts in hepatitis, public health, epidemiology, data management, and informatics. The workshop was successful in establishing an expert consensus on the terms related to viral hepatitis. The consensus report was submitted to the Department of Health for inclusion in the National Health Data Standards. Once these standards are adopted by the EMRs, it will be possible to collect consistent hepatitis data. This will enable more informed and meaningful programs and policies for hepatitis in the Philippines. On behalf of the team, thank you very much for taking time to hear about our project. Salamat.